Persistent vaginal bleeding following a miscarriage. This case was a 26-year-old with a history of recurrent first trimester miscarriages being evaluated for antiphospholipid syndrome. She had a spontaneous miscarriage at about 12 weeks gestation, 5 weeks prior to presentation. She then presented with vaginal bleeding, which has persisted since then and worsened over the last week, associated with passage of clot. Urine pregnancy test incident dilution revealed positivity of 1:10 4 weeks after. She was treated for endometritis at her first visit and was also given tranexamic acid. She had no other systemic symptoms. In examination, she was found to be pale. Following examination revealed blood-stained vulva. Other findings were unremarkable. Ultrasound findings suggest presence of retained products of conception. So she had a manual vacuum aspiration. During the second visit, suspicion of gestational trophoblastic disease was met, and that was why she was asked to do a urine pregnancy test in serial dilution. Now here let's look at the common causes of persistent bleeding following a miscarriage. But one thing I want to emphasize here is that the commonest cause of persistent bleeding following a miscarriage is retained product of conception. And this is exactly what the patient presented with. She presented with persistent bleeding associated with clot in the last week. There was no associated abdominal pain, but ultrasound revealed echogenic intestinal mass with increased vascularity, which is consistent with retained product of conception. Yes, endometritis is a differential diagnosis, but this patient does not have features of endometritis. Gestational trophoblastic disease is an important differential to rule out, but with the pregnancy tests of 1:10 positive 4 weeks after miscarriage, to a large extent rules out gestational trophoblastic disease. Patients with enhanced myocardial vascularity, or what others call arteriovenous malformation, commonly present with profuse vaginal bleeding, and the ultrasound findings are classic. Of course, if there was coagulation disorder in the history, will give a light. So now looking at how to interpret this 1:10 positive pregnancy test 4 weeks after a miscarriage. The most important differential diagnosis of a miscarriage in this case is molar, I beg your pardon, the most important differential diagnosis for this condition, patient presenting with persistent vaginal bleeding, is a molar pregnancy. And one way one can rule that out is to do beta HCG, because the facilities are not readily available and they are expensive. We rely on serial dilution. So a serial dilution of 1:10 suggests that this is likely to be a miscarriage rather than molar pregnancy. So now let's look at the ultrasound image. So this is a transabdominal scan. You can see the bladder here, the vagina. You can see blood in the vagina. You can clearly see the anterior and posterior of the cervix. And you can see products within the cervical canal here. These are retained products. And in the endometrial cavity, you can see this heterogeneous lesion is consistent with retained product of conception, 5 weeks after miscarriage. Now look at this color Doppler. You can see these are the aquatic vessels, and you can see the object of color by the retained product, suggesting that these are still live tissues. So this is just playing around with 3D, but it's not necessary to make that diagnosis. But if the facilities available, why not? As you can see, look at the coronal view of the uterus, look at the retained product of conception here, the mention, and part of the product of conception. in the cervical canal. And of course, after manual vacuum aspiration, you can see the product of conception, confirmed histologically as retained product of conception. So our takeaway message is that the commonest cause of persistent bleeding following miscarriage is retained product of conception. Ultrasound can should be employed early and liberally in patients presenting with persistent bleeding following a miscarriage. If this was done in this case, it would have prevented the prolonged bleeding over 5 weeks and also the anemia this patient developed. So thank you very much for listening.